Hello everyone. In this video, we're gonna be talking to Dr. Melina. She's a JVMS member, and she's gonna be talking to us about Chinese medicine. She's gonna tell us how she got into it and some other details that you'll find very interesting. So welcome. How you doing?
Thank you. Good to see you. Thank you for having me. First of all, what do you know about acupuncture and Chinese medicine?
What I know is that there's some energy in the body called qi, and then when it comes out of balance, then you can use acupuncture or massages or other techniques to bring the body back into balance.
Absolutely correct. So, how did I get into acupuncture? So, my name is Dr. Melina. Many of you guys have seen me working at the ER the last couple of years. I got into Chinese medicine as a solution for my own health issues. When at some point I had a car accident and I had a full-blown cervical hernia that it was compromising the mobility of my right dominant hand, and I was in a lot of pain and unable to function properly. And the only solution that I found in the Western medicine, it was neck surgery. This happened 7 years ago. So we're surgeons as well, and we truly know that sometimes spinal surgery is not like the best option right away, and if we can find something else to do before going through surgery, that will be better. That was my case. I was in a very chronic pain situation and with mobility issues. The only recommendation was neck surgery, and then I started to do my own research, and I literally Googled, what can I do for pain with no pain medications or no surgery? And the only thing that popped up on my screen, it was acupuncture. And then I started to do the research, and I read everything that you just described. That acupuncture manipulates pretty much the energy of the body, and it can release endorphins, and in that way it can control pain. So it was kind of like a good option for me in that situation. And I just found a practitioner and I went there. And I can tell you that at the time that I walked into that appointment, I had completely compromised the mobility of my right hand. I couldn't feel the fingertip of these last three fingers. And I was in severe pain weeks ago. The accident at that point happened like a couple of months before, and I was still in very strong pain. I had my first session. This practitioner put acupuncture needles on me, and that time he did electroacupuncture, which is pretty much plugging some electrical wires and putting some electrical current on your acupoints. And the same day I walk out of that place, moving my hand and with 80% less of pain, which it completely changed my plan of, going through a hospital and having neck surgery.
So you believed it because it worked on you?
It worked on me. And then that day I walk out of the place like, wow, like, what is all this about? And when I was in the office, he had a bunch of like things on their walls explaining all the conditions that you could potentially treat with acupuncture. And then I read about depression, anxiety, insomnia, overweight, diabetes, chronic kidney disease. I was like, wait, like, how is that this works for all these conditions and we don't even know about it? And then I went home, like with all this hunger to understand what was this medical procedure about and what was the science behind it. And what I found is that they have been practicing acupuncture and Chinese medicine in China over 3,000 years ago.
Because you were explaining to me, it's sort of like this house has electricity that comes into it. So if you find where the electrical outlets are, you're able to balance
exactly
like the energies of the house.
Exactly. So let's put this example. Like imagine that our physical body is a house, and what acupuncture does is manipulating the electrical grid of that house. So our house has an electrical grid, and you control that with the plugins and the interrupters, right? Our body has an electrical grid, and it's these electrical lines are called meridians in Chinese medicine, and the electrical interrupters are called acupoints. And then when you know the meridians distribution and how the energy flows in the body, you are able to manipulate these interrupters and target that energy to flow to the organ that you want to rebalance. So Chinese medicine understands that number one, we are part of nature, and that our body contains the 5 elements that we see out in nature in different balances. So the imbalance of these elements and the imbalance of this energy flow, which is called qi, is what causes the different diseases in the body. So if we rebalance the energy and we give the right fuel and the right conditions to the body to heal, the body can heal itself. And this is valid for pretty much every chronic condition that we see out there, that sometimes Western medicine does not have another option, or they don't really have a lot of more to do for that patient. We can extend the quality of life of a patient, we can extend longevity, and we can reduce pain only using acupuncture and Chinese herbal medicine.
Yeah, because we were also talking, there was I've had this experience many times that you give a diagnosis for an animal and the human has the exact same disease, where it be a cancer or like some sort of metabolic problem, diabetes.
Exactly.
So it's not only the environment and the food, but it's just like the whole energy of maybe the environment.
Yeah, so one of the shockiest things that I learned in the last year, learning about Chinese medicine, is that animals in children until 14 years old, they literally mimic or reflect the energetic situation of the caretaker, or, you know, in this case, we talk about client's owner, caretaker of the pet. So pretty much kids and pets, diseases are a reflection of what's wrong with the owner, which is pretty logical because, as you say, how many patients have we had with diabetes, and you see the cat and physically the patient is looking exactly like the owner, and we kind of like make of this a common joke, you know, like Yorkie owners are always accelerated and very attached, and they have the Yorkies here all the time, the Yorkies all shaky and nervous, and Chihuahuas are always like very attached to the owner and very defensive, and these people is very attached to their pets too. So you can definitely link, like, every pet, it's a true reflection of one of the owners in the house. It cannot be necessarily the one that is bringing the patient to the house, but this patient is always bonded to a specific person in the house, which makes them absorb the energy and absorb the processes that they are having in their bodies and manifesting that as disease. Example, tumors. How many cases we have seen in a family where they have had 6 dogs, and the 6 dogs, they all have cancer at some point. Isn't that interesting?
Yeah.
Well, this is the answer, is because our pets are reflecting our lifestyles and our energetic states. So when you see a person that is overweight and has ligament issues, 95% of the time her dog is going to be overweight and is going to have ACL issues, hip issues, or, you know, chronic arthritis issues.
I agree. So, moving on. Another topic that you're interested in is mental health. And this is something that vets have a problem with. Where, in my experience, I've seen a lot of vets that they come out of school really with a lot of enthusiasm. And then they just, like, their lights go out and they become like zombies. You know, due to the stress and student loan and another series of problems. Could acupuncture help with that sort of condition?
Absolutely. So part of the training as traditional Chinese veterinary practitioner is that you have to rebalance yourself, and you have to take care of yourself first, mentally, emotionally, and energetically, in order to be a good practitioner. Why is this? Because if we are manipulating the energy of an animal with your energy unbalanced, you are either going to reflect your imbalances in that patient as well, or you're either going to be too fragile and you're going to absorb things from that patient as well. So it's going to like warn you off more if you're not in a state of balance.
Yeah.
So how do you do that? They teach you some practices, breath work, meditation, just sitting still for 5 minutes and try to
Meditation,
calm
yes.
down. I think the basic problem that veterinarians are having is that you have to have certain sensitivity and certain level of empathy to be a veterinarian. And of course, that means that you are more emotional susceptible to engage with these animals because you're concerned about their suffering and all that stuff. If you don't have a good way to rebalance yourself, the work schedules, the exhausting sometimes study programs are going to warn you off to the point that you're going to have all these mental issues. It's just a true reality in veterinary field.
You said something, and I remember. I've had various technicians because they come and go. But I had one. It was a kid. He was like a fidgety guy. He was very nervous. Whenever he would touch a cat, the cat would try to kill us every time. And then I worked with other technicians that they would just go up to the cat, grab the cat, do anything to the cat. The cat was just fine. And I always thought about that. Why is it that every cat tried to kill that kid? And I think it's because of that, just his energy. The guy was off balance.
He was afraid of the cat.
He was afraid.
He was afraid of the
cat.
cat.
He was. He was terrified.
Yeah, it's absolutely
He
true.
was terrified of cats.
I enjoy sometimes like teaching this to my technicians. Like example, if you have one traumatic experience with one cat, and you are not a cat person, the rest of your practice, you're going to be afraid to go to touch another cat because you're going to remember that horrible experience where the cat literally chew your hand off or whatever, right? So then when you go and approach the animal with that energetic state, like you're afraid of the animal, they can perceive that, especially cats. Cats don't see your physical body initially. They can literally see your aura first. And when you go closer is when they actually can see your physical body. So the first impression that an animal is getting from you is your fear. And of course, if you're in fear, that cat does not want you to touch him because you're going to transfer that stress and that chaos onto him.
In your opinion, what do you think about social media and mental disease? Because in my opinion, I think it's causing a lot of harm. Just it's become like an antisocial media.
It is.
And I have a funny story. I started this Facebook page for the JVMS, and during that time, I was off social media. I hated it. I had a problem, and I shut off all my social media, and then Dr. Crystal asked me, do you want to do the social media for the JVMS? And I was like, yeah, sure. So I got into it. And for a long time, this page was just me posting stuff and Dr. Crystal liking it. So I was just posting for him until more people got in on this page. But I have seen some good things and I have seen some bad things. And one of the bad things is when vets, either they make a mistake or it's a perception of a mistake. You got like all these people just attacking you. And you don't know who these people are. And it creates a sort of mental disorder. This happened to me just last week. Just got bombarded with negative publicity. What are your thoughts about how people could manage this type of, because we're trying to get attention, but sometimes we get the wrong attention.
Yeah, unfortunately.
And it rattles you.
I understand completely. I am in the same team. Actually, this is my first time like trying to step into social media because I think that there's a lot of important information now that we can share. But of course that social media can be really harmful. People believe that they know better than a doctor, number one.
Everybody's a professional.
People sometimes is extremely dramatic about like if you're not wearing gloves when you're handling a patient. So you have all this stress just to prepare a post for social media. Like I don't wear gloves, people, 100% of the times because there's for me it's so difficult to handle a patient with gloves. And there's really a minimum amount of things that I can really get from my patients. So for me, gloves are not 100% a priority. Like my priority is to solve the situation of my patient. But if you have some cool patient and for some reason you're not wearing gloves, that video is a knife from your own neck. So you have to be so extremely careful of that you want to record or that you want to see. That for me is like it doesn't worth my energy. But now a new need is it's rising. It's the need to share with other veterinarians that they are not alone.
Yeah,
it's
no,
the
that's
need,
true. That's true. I was thinking about
it's
that.
the need to know that we're doing a great job, and it's the need to know that yes, we can have mental issues too. It's okay. Like, we're humans. We can fail. As an overthinker and a person very, very like perfectionist, for me it was a burden when something doesn't go well with a patient, or where I really don't know what's going on. So the last thing I need is to post something on Facebook trying to make, help or show any sort of information, and having a lot of people complaining because I'm not wearing gloves. So
And it's probably the people that are always trolling and complaining and giving the negative reviews. Those are people that are probably having a lot of pain within.
Yeah,
so they're
yeah.
projecting onto it and causing
Absolutely.
disorder. And then vets are they got to start flexing up.
yeah,
You shouldn't be taking, like, I've always been terrified of getting a negative review, a 1-star review on Google. And a couple of months I got it, and I'm still alive. And the guy was upset because he said we were rude to him on the phone. Like, he's one of these men with tender feelings, so he gave me a 1-star review, and that's fine. I don't want that guy as a client anyway. He did me a favor.
You're not gonna be able to have 100% of your clients happy. That's
can't be
impossible.
liked by everybody.
Like, you
Yeah.
can be the best doctor ever for certain clients, and other clients are gonna say that you suck, and that's okay. Especially like coming from the ER, that's my life every weekend. So if I will live in function of reviews, I will kill myself in 2 weeks. Like, because some people is not happy about what you have to say about their patients. Multiple people is not happy about the pricing of the ER, which is not on my control because I
Right.
just work there.
You might do everything right, but the expense was too much for that.
The bill is too much, or you came to the ER with your dog with an ear infection, and then there's a dog bleeding out, which I had to see first and save his
Right,
life for
right.
the prior 3 hours.
Priorities,
So
yes.
then when I go back to see the ear infection, this client is rude and like hateful just because he had to wait 3 hours. Like, we cannot absorb. Like, one of the things that have saved me the most in these last 2 years as a ER doctor is observe but don't absorb. And it's really hard for a person like me because I'm highly empathetic to the point that, if I see an elderly person with his dog with a cancer diagnosis that is going to die, I want to freaking cry with that client. Like, I feel their pain. Like,
Right.
I want to be empathetic, but how many situations like that I have in a day?
A doctor told me that you gotta be a mirror. You can't be a sponge.
Exactly.
Because then that leads into compassion fatigue. It deals to the depression, and I don't know. It seems to me, like, especially in the suburbs, a lot of people. Most of the people are on Xanax, and the kids are on Ritalin. Have you noticed that?
Absolutely. Like 90%.
Downers at night and uppers in the morning.
80% of the population is under any type of medication.
They're all on
And that's
meds.
not normal.
Yeah.
Especially like when you have been in other part of the world, or when you came from another side of the world, you can see it clearly. Like, because it's easier to handle your, like a person that you don't understand with a couple of pills, that trying to sit with that person and say, okay, what's the trauma that I have in my body or in my family household that is leading me to be an ADHD person, example.
Maybe this could be, a supplement to the medications. Because I've gone to, like, the human doctors, and they barely spend any time with you. Oh, what's wrong? Oh, I have this. Oh, and then
Get your
they're
pills
off.
and go home.
They could care less about asking about my lifestyle or mental health. It's just, here's some pills, and they're probably, they got a whole bunch of things to do too.
Well, the base is the problem. The base of the training of the doctors, it's where the lag is. So you, as a veterinarian, how many times were you training nutrition? How many times were you training behavior so you can address your clients, like inform your clients what's the best breed of that dog if you are a person that don't go anywhere. Like, if you're a 60 years old retired human, why are you getting a Malinois? Like,
Yeah, exactly.
they don't teach us about that. Those are things that we need to learn in the way, and that happens
If
the
you're
same with
elderly, you don't want a dog over 15 pounds,
Exactly.
12 pounds,
So-
because you can't, if that dog can't walk or anything, they're pretty much, what are they going to do with that dog?
The problem is if we keep treating our bodies and our health like an object and not as a combination of a body, a soul, and a mind, that it needs to be addressed in those three different aspects to go to a balance. Western medicine is pretty much taking care only of the external, at a molecular level. Okay, you're depressed. Here's your Xanax. There
medication.
you go. But who goes over what's the diet of this person? Is this person consuming a lot of sugar, alcohol, and other type of food inflammatories that can change the chemistry of his brain and lead to more depression? Like 85-90% of the population diet is nowadays. Nobody goes to the deep part of the equation. Everyone is trying just to cover the symptoms. You know what I mean? So that's where the problems start. Like if you have a type of personality from the Chinese medicine approach, if you have a type of personality that you're more tend to be inwards, that you're more tend to be like sad or towards sadness, if you have a high demand performance job, you're going to be depressed in a few months because that's not the right environment for you to work. But you don't have the option to choose. You just have to fill your application and go work wherever they call you for.
So tell us, we also spoke about you had some patients and you put, was it medications or was it just acupuncture? You had some patients with IVDD, spondylosis, osteoarthritis. When you see these type of conditions, what are some options that you have in your toolkit?
Well, now, of course, like the goal is to practice integrative medicine. We're not saying that we're going to stop using the technology or the good part of the Western medicine, which is, example, emergency medicine. You cannot fix a broken leg with needles.
No.
You cannot, like fix a hemo abdomen only with needles. You can help with needles, but you need to go surgery and fix the broken spleen.
You can't tell them to meditate.
Exactly.
While I have a broken leg.
So, the Western medicine is great for acute emergency situations, yes, for broken bones, things that need to be fixed right away. And the Chinese medicine is a great tool to rebalance the body and to take back the body to a state of balance, and that means correcting the disease. So Chinese medicine understands that the body has the ability to heal itself if you give it the proper condition, the proper fuel, and the proper time to regenerate. So that means we target with acupuncture, we have herbal medicine, we have food therapy, and we have tuina, which is like energetic massage that you do following the natural flow of the energy in the body, but with the pressure points. So these 4 tools are available to address the situation. So example, your cat. If your cat is not good for me to place needles, I can work your cat with acupressure, massage, and herbal therapy. Something that you can just put in his food and give him medication, herbal medication for a few weeks. If your dog is, a very senile dog and he can stay still for a few minutes and I can put my needles, I can address his arthritis and IVDD with acupuncture, electroacupuncture, and herbal therapy, and food therapy. So we're always going to address the 4 points in every patient. That's why we call it an holistic approach, because we're taking in account the whole of the patient to fix whatever situation he's going through.
That's good to know. And just to wrap it up, October 14th, which is tomorrow, right?
It's tomorrow.
Yeah, tomorrow is the business meeting at Epping Forest, and hope you can make it. Dr. Melina is interested in the wellness chair, so she might be talking more about how to keep your mental state balanced, which is very important.
Very important.
You can't just work all the time and be stressed all the time. You gotta take a vacation once in a while and relax.
Relax.
That's what I like to do. If I'm stressed, I just don't do anything.
Well, you're the best. You're the first ambassador, and I love it, because every single time that we are like emailing back and forth, you say, "Hey, remember not to work too much and take care of yourself." Yeah. Like that's a reality.
I just like doing these YouTube videos. I was doing YouTube videos before YouTube when I was like a teenager.
Really?
My parents bought me one of those recorders that you put on your shoulder.
Really?
And I would just go record people and annoy people. And I still have that content.
That's nice.
So you see it now, So please remember, October 14th, Epping Forest business meeting. And we'll see you there.